I really appreciate the caring professionals who work with me during my stay. I'd like for both of you to tell us about the staff and your team approach to rehabilitation.
We do have a team approach, and it kind of starts with the rehab physician. I'm a board-certified physical medicine and rehabilitation doctor, so I went to 4 years of medical school, and then I did a residency for 4 years in my specialty. I'm actually called a physiatrist. It kind of sounds like psychiatrist, but it's someone who really oversees the whole rehab program. Our rehabilitation nurses have gone through extensive training in rehabilitation. They usually have to have a number of years of experience in a rehab hospital, and then they can take a test and they can become certified as certified rehabilitation nurses. We also have therapists, physical, occupational, speech therapists that are involved in the team, and we usually have a team meeting once a week. It's led by the rehab physician, and the nurses, therapists, and other people that are involved in the patient's care, the case manager, will attend that meeting, and we'll talk about how the patient's progressing in therapy, any kind of barriers to discharge home, and then try to see if we can come up with a plan to transition them home.
Beth, can you add to that?
Yeah, as you know, there's just some really terrific, wonderful people that work here that just have a passion in their hearts to take care of patients and do the best that they can for them, so get them back to an independent level to where they were prior. There's quite a bit of tenure at our hospital. Our hospital has been here about 25 years, but we've got some therapists and nurses that have been here 5, 10, some even 15 years. So they're very committed to what they do. As I mentioned earlier, our length of stay is about 2 weeks, so our clinicians really get to bond with their patients and they get to see the progress that they make from when they came in to when they get to go home.
Let's talk about your facility now, Beth. You mentioned that this is a 75-bed facility, but within that there are 2 specialized units. Can you tell us about those?
Sure, yeah. We have 2 special areas that we have become accredited by the Joint Commission from on our brain injury and our stroke. So we have a 6-bed brain injury unit that we designed specifically for patients that suffer from a brain injury. It's a very small unit. The staff has been educated and trained specifically for that population. We have cameras in their rooms so that when they come in, a lot of times brain injuries come in and they're a little agitated. So we're able to look at them on the camera, and it gives them a little sense of independence and it relieves some of their anxiety. And then we have a stroke unit, a neuro unit that's 18 beds, and again the staff is specifically trained and focused on that area.
If I remember correctly, patients don't stay in their rooms much.
You're right about that, yeah. We get them up and going. They're out in the dining area having meals. You know, when we go home, we don't eat in our bed, so here they go into the dining room and eat, they get dressed. They have classes every day at 3 o'clock that they can learn about strokes or pain or diabetes, Coumadin management, so there's a lot of activity for them. And then of course, therapy is the big part of their day.
Dr. Kravetz, what other services does HealthSouth offer?
Well, in addition to just general rehab, we take care of the patients I described earlier. We have a number of specialty programs. Beth mentioned the traumatic brain injury and stroke program, but we also take care of dialysis patients, and that's a population in the community that's kind of caught in the middle. It's difficult sometimes when those patients are in the hospital to get them admitted to a facility where they can get rehab and medical care. Skilled nursing facilities or nursing homes a lot of times will not take those types of patients, and we have the ability to do that. So we have a specialized program where they can get dialysis 3 days a week. They get the intensive therapy and the medical management, and that's one of the kind of the bigger programs that we've had, and we've had that for about 2 years. We also have a cardiac program and a pulmonary program, so we take care of patients with heart and lung problems, someone who may have been on a ventilator, you know, a breathing machine, and had a tracheostomy tube in their neck, and we have specialists that can come in and evaluate those patients in addition to the rehab docs. We also have something that I think is kind of unique to our facility. We have a very extensive teaching program in our hospital. We have students that rotate from Midwestern University, the pharmacy school, and our pharmacist actually teaches at the university there. We, at any one time, will have a number of pharmacy students that will be here to help educate patients. We also have students that rotate from other schools. We have therapy students and nursing students that come to our facility to kind of learn about rehab. And they're really the next generation of rehab providers. So we really feel like we're doing a great job of educating the future providers for rehab.
How do you transition patients to get them ready to go home?
We have a team conference once a week that I mentioned before, and we'll initially talk about some of their goals and any barriers that they might have to being discharged home. And we do a lot of education with the family and the patient when they're here in the facility. We also have an educational program, kind of a discharge planning conference with patients. It's usually run by our case manager, and that will help them to understand what they need to do to get home and be more independent. We also have something that most places don't have. It's an independent living apartment, and it's like a simulated apartment. It looks like a studio apartment with a kitchen and a bathroom and bedroom, and patients and their family members can stay in that apartment for a few days, and it gives them a little bit of comfort. If they have any problems, we have medical staff around and nurses that can help them, but it makes it easier for them to transition home.
Some patients prefer to and are able to do therapy from their homes. Tell our viewers about your outpatient care program.
Yeah, we have 2 levels of care that a patient can transition to. One is outpatient, where they'll come back here and come in this gym and do therapy maybe twice or 3 times a week. It can be PT, OT, or speech. And then we have a home health agency where if the patient is homebound, a nurse and therapy team can go into the home and help get them strengthened to get back to their prior function there as well.
The care is excellent at HealthSouth, and it isn't just the patients like me who think so. So I understand you recently won a very prestigious award.
Yes, we've won a couple of awards. Most recently, Dr. Kravetz was awarded the Medical Leadership Award for the Western Region in HealthSouth. And then HealthSouth has what they call a President's Circle, and it's really for the top 10 hospitals with their patient outcomes and patient experience. And we were able to get that award 3 out of the last 5 years, so it was really exciting for us. And then most recently, we were accredited by the Joint Commission for another 2 years in our brain and stroke programs. And then we had one final award that I'm especially proud of. Beth Lynch, who will be speaking next, is one of our speech pathologists. And a couple of years ago, she was awarded Employee of the Year for the entire corporation. So out of 23,000 employees, she was selected as Employee of the Year, and she's just a really stellar employee. She's been quite instrumental in developing and getting our brain injury program up and running. So she's a great person to work with.